All right, everyone, can you hear me? All right, great. Well, you all just saw the FA and speech toolkit at the end of the advocacy presentation, and as Brigid mentioned, we're going to dive in a little bit more to that toolkit. But before we get started, I want to do some brief introductions. So first and foremost, I'm Emma Potter. I am the Advocacy Program Coordinator at FARA, and I'm here with Brigid Brennan, who you just heard from, Director of Advocacy, as well as Caroline Spencer, who is so wonderful to join us. She is an Assistant Professor of Speech and Language and Hearing Services at Indiana University, so expert in the subject matter here. And without further ado, I think we want to dive a little bit into speech, but before we get into the new resources, I want to pass it to Brigid to explain a little bit more about communication and public speaking.
Thanks, Emma. Okay, so every day in our conversations with our family and friends, we share what we want and what we need, and we don't really think about it. But there's actually a whole process that our body goes through, right? Cognition, we think about what we want to say, we find the right words, and we say them to the people that we love. When you're in a situation sometimes, either with someone you're not familiar with, someone of a particular esteem and power, like a doctor or a legislator, or if you have to give a speech in front of other people, that adds a new element to what you're used to doing every day. And as I mentioned earlier, 75% of people report that they have trouble when they're faced in that situation. Now, it doesn't mean they're scared necessarily to be in that situation. If you think of an actor or actress who's about to go on stage, they may have some butterflies, right? They're excited about going on stage. It's what they want to do, but their body's responding to that adrenaline rush that they're getting because this performance is important to them. And so they feel some of the same things that you may feel if you're in an anxious situation where you're nervous about speaking in front of public. You may have the sweaty palms or the racing heartbeat, and you might feel like, oh my gosh, I'm the only one that feels this. And you're wrong. Most people feel that even if they do that stuff for their living. I bet the three of us have all felt that way when we've had to give speeches in our careers. So we want to level set that, like, having those general feelings is normal. Now when you add FA on top of it, we have some new challenges.
Absolutely. And so, Caroline, would you mind expanding a little bit on the process of, what's happening with speech in FA?
Sure. So, as we all know, this FA affects the cerebellum. And the cerebellum is really important for speech. Speech is just another motor activity, just like walking or fine motor movement. And it's the way we communicate. So the cerebellum's job usually is to coordinate timing of all those fine movements for speaking, coordinate the scale and size of movement, and coordinate how well all those different muscles work together to help you speak. The cerebellum is also involved in getting sensory feedback and using that sensory feedback to then inform other upcoming movements. So how well did I do? The cerebellum and the brain is responsible for constantly monitoring that loop. So when the cerebellum or cerebellar pathways are damaged like they are in FA, that can lead to discoordination of those muscles that are involved for speech. They can lead to abnormal timing. So maybe normally you should activate like your tongue and your jaw at the same time, but now the timing is off, so your jaw moves and then your tongue moves. And that all can lead to dysarthria or slurred speech. So there are different kinds of dysarthria, but just kind of the general umbrella of slurred speech is what we're talking about. FA can also affect swallowing. So swallowing is very related to speech. So, and we call that dysphagia. So most people with FA have what we call ataxic dysarthria, and any dysarthria can affect respiration. So how you breathe when you speak, your voice, so how well your voice is turning on and off. Is it turning on and off at the right time? Is it being coordinated with your breath? And then we have nasality. So usually when we speak, there's a little muscle in the very back of your mouth called your velum, and that constantly goes up and down. And that helps you regulate how nasal you sound when you speak. And the velum, that little muscle, cannot be moving as quickly or sufficiently in FA. So oftentimes it makes you sound more nasal than people without FA. And then we have articulation. So articulation is like using your tongue, your jaw, your teeth, your lips to enunciate certain sounds. And then we also have prosody, so kind of the natural rhythm of speech. Speech usually goes up and down depending on your emotion. When you have dysarthria or FA, sometimes that can get a little flat, so it sounds monotone, or like you're bored when you're talking, even though you're not. And prosody kind of brings up intelligibility versus naturalness. And Brigid's going to help us explain or understand what those two things mean.
Well, intelligibility is if somebody could understand what you're saying, does it make sense to them? And naturalness is sort of the ease of the conversation, how it's going between you. And I think there's probably some combination of how people deal with those, right, Caroline?
Yeah, so intelligibility, you can focus on pronouncing each word very slowly and specifically, so your intelligibility is pretty perfect. But sometimes there's a trade-off where even though each sound is perfect, you're not very natural in how you talk. And so, as a person with dysarthria, you will need to kind of manage or work with people to help you manage when to be more intelligible and when to be more natural. And then I also wanted to mention dysphagia again. So that's difficulty with chewing and swallowing. And just like speech, you have to coordinate chewing and swallowing and breathing when you're eating and drinking. So the cerebellar effects of FA can lead to difficulty managing all that at once.
So yeah, now that we've talked a little bit about how FA impacts our speech, I think we should zoom out a minute and level set, why is speech so important and why are we even having this conversation to begin with? So Brigid and Caroline, would you mind kind of expanding on some of these aspects of why we're even talking about this in the first place?
Yeah, so speech is very important in your everyday life for things like self-advocacy, saying what you want, what you need, communicating with others. That can be as simple as ordering what you want at a restaurant. It can be more, another level up, like explaining to your doctor what tests you need or problems you think you have and advocating for yourself. It can be just your relationships, your friendships with people, significant others. It can be at work, at school, in personal life, all of it.
In addition, when you are thinking about advocating for legislative pieces or funding in the government, we seem to think that lawmakers know what we need. And I use this example with the ambassadors on Saturday, is if we needed something from Walmart, we wouldn't sit at home and assume Walmart would show up on our door with the item we need, right? We would drive to Walmart and we wouldn't stay in our car. We'd actually go into the store. And when we got into the store, the workers aren't going to still know what you need, right? So now you have to explain, I need shelves. I'm going to put the shelves above my desk. And the Walmart person is going to, one, direct you how to get to the product you need. They're going to show you in the store where that product might be. Or they're going to say, we don't carry it, but you can get it online. Let me help you here. Or we don't carry it, but we'd love to know more because maybe we'll order that product, right? All those things are advocating for what you need, but it's helping the provider know what the community needs. And that's kind of what legislation also entails, right? They don't know what the FA community needs. If we wait here and we just expect they're going to pass things and fund items that are going to help us, it's not going to happen. They don't even know that we need this stuff. We need to go there, and it's our responsibility to educate them about our disease, about the community, about the research going, and what they can do to help find the item in the store, order the item online, fund the things we need.
Absolutely. Well, thank you so much for those detailed explanations. And now that we've kind of touched, on the aspects of how FA impacts speech, as well as, why we're even having this conversation in the first place, I was wondering if you two would be willing to expand a little bit on some of the resources that are available for members of the community if they're interested in learning more or trying to just become more confident in speaking for the purposes you just discussed.
I would love to. I'll jump in with the speech toolkit, and you heard me mention it in the advocacy group. So a little background here. We've been running the Hill Day 7 years, and when we are done, we always sort of do some reflection on how did it go, what could we do better. And some of that involved going out and talking to some of our advocates that either participated or withdrew. And we'd ask them, hey, why did you withdraw from the Hill Day? Now, sometimes they have a real legitimate reason, like something came up at work, I couldn't do it. But several times we were hearing the comment of people were concerned that their speech would impact their presentation. I'm going to be too slow. I have to take a lot of breaths when I tell my story. I have to stop and take a drink of water. And we wanted to figure out a way to have that conversation with our community that is okay. All of those things are okay. That's part of what your life experience is. And if it takes you longer to tell your story, or it takes you an opportunity to take a pause or a drink of water, that's part of the presentation. It's okay. So I was actually at ICAR in last November in London, and I was listening to a woman who worked with Ataxia UK on speech issues. And she had set up a whole support group and workshop program through Ataxia UK. And after her presentation, I went up to her and I said, would you be willing to help us do a toolkit for our team when we want to work on advocacy events? And so she graciously has been working with us since then, almost a year now. Professor Anna Lowit, you'll see her name in the toolkit. She helped us develop this toolkit. She shows a lot of what Caroline is bringing her professional experience today to explain a lot about FA and speech. Professor Lowit does this in the toolkit and gave us exercises that we're going to do a couple today. But that is kind of how the toolkit came about.
Awesome. Now, Caroline, would you mind going a little bit more into your realm of expertise and the other resources beyond the toolkit that are available?
Sure. So I am a speech researcher. So I can kind of speak to the clinical services you can get from working directly with a speech pathologist or an SLP. So speech pathologists can work in pretty much any setting. They can work in the school, in healthcare, in hospitals, private practices, so they can just own their own business. They can do telehealth, and they can work individually with you beyond the toolkit to help with your communication needs. And then I also wanted to remind you again, so we've heard a couple reminders today about the FAA clinical management guidelines. So speech and swallowing guidelines are in the FAA clinical management guidelines. There is a chapter on each of those on the website. I think we have a screenshot in here that you could take to a speech pathologist and make sure they know about FA and what research says about speech or swallowing.
Great, thank you. And yes, we will be expanding on that in a little bit. But I want to dive a little bit into all of these resources. So first, I'll turn it to Brigid. Do you mind explaining a little bit more about what's in this toolkit? Where can people find it? How can they utilize it? And all of that.
Sure. So you already saw the intro videos. This is when you go to the toolkit, this is the top header of the page. And it has a little intro video, which we showed at the end of the advocacy segment. If you go a little further down on that page, this is really sort of the meat and potatoes behind the toolkit. This is Professor Lewitt's about 25-minute presentation, and she walks you through what's happening with a speech with FA and some exercises to make you feel more comfortable and confident speaker. She also was gracious in giving us additional resources that she had created for her support group program, and that's going to be in the bottom section of the page that is under resources. In addition, we've made a few one-pagers available there that you can go back and look at if you want to sort of remember something you've seen in the presentation, as well as there's a mock meeting that Mary Nadine Scott was gracious enough to help us with to give you a sense of how effective you can be in a meeting, even if you have a challenge with speech.
Great. And would you just be willing to share a little bit about how can people find this resource? Is it a web page? How can they get access?
It is in the advocacy section of the FARA website.
Great, thank you. And now I want to turn it a little bit. We just went over some of the stuff, and obviously we mentioned that there is a presentation covering some of these aspects of FA and speech, so you can learn a little bit more about the science, but we have another resident expert with us here. And so, Caroline, would you be willing to walk us through maybe a little bit about some of the information about FA and speech, the research that's happening, and just give a little teaser of what's in the toolkit?
All right. So as I mentioned earlier, there's kind of 5 components of effective speech production. So kind of the bottom, your foundation, is your breath support or respiration. And that supports your voice in your larynx, turning it on and off. And then you have articulation. So again, moving your mouth, your tongue, and nasality and prosody. So one technique that's in the toolkit that we thought it might be a good introduction to try today is trying this breathing technique. It's really just bringing more awareness to how you are breathing. So if you could place one hand on your chest and the other one on your abdomen and just kind of breathe in and out, and notice that both your chest and your abdomen should be moving. So take a deep breath in, and when you take your deep breath in, we want your abdomen to push outward first. So you might be familiar with like diaphragmatic breathing. So this is making sure you have enough air, probably more than usual. supporting your speech. So the hands kind of help give you feedback of, yes, I'm moving, like I'm breathing enough. The other thing is we don't want your shoulders to raise up. So we don't want tension in your shoulders. It should all be like in your abdomen and in your chest. So go ahead and take a good deep breath. It's so quiet. That's probably pretty easy to tell. So the next exercise we're gonna try is supporting your voice or practicing using your voice. So this exercise is gonna have you say "ah" for as long as you can. So first thing, remember to use that good breath that we practiced. And it doesn't matter if you're on key or off key, it really does not matter. It doesn't matter if it's bad. It's not bad. So we're just trying to get your voice warmed up. So take a good deep breath. Very good. That's great. And so that's another thing you can do to, one, kind of calm your anxiety about speaking is to really focus on your breath and your voice. And also physiologically kind of warm up your breath and your voice for talking. And then, so the last little exercise that we're going to try is an articulation exercise. So we're going to say a sentence together and practice slowing down. So you might think, why do I slow down? I'm already slow. Well, in speech therapy, we talk about slowing down even further. So that's to give your body more time to make it more intelligible. So slowing down, even though you're already slow, can help get your message across. And again, that can help calm your anxiety a little bit. Everyone tends to talk really fast when they're nervous. And so that conscious slowing down can help you be more calm and confident, and helps with the intelligibility. Go ahead and add pauses before difficult words. Break long sentences into shorter units. So it might not be your first thought to add in pauses, but that can help with people being able to understand your message. And then the third thing with this is make sure you're loud and clear. So use your breath and your voice that we talked about to help make your sentence loud and clear. So the sentence I thought we could try is the physician wrote out a prescription. So you can break it down into small chunks like that, or say it faster. So use your good deep breath. The physician wrote out a prescription. Go ahead and try it. Very good. So that's kind of one example of how you can use all these techniques to build on one another to help get your message across and alleviate some of the anxiety. I wanted, oh, go ahead.
Oh, I was just going to say thank you so much for that explanation, and this is really wonderful. That was just a reminder for the audience, just a little teaser of what's in the speech toolkit. So we encourage you to go explore some of the other tips and exercises that are available there. But we want to acknowledge that sometimes there are moments where, these resources might not get you to the point that you're feeling confident or comfortable enough. That maybe you want some more individualized support, or there are things that were working for you but aren't necessarily working the same anymore. So we wanted to ask Caroline, in your clinical opinion, when is it time to consider seeking help from a speech pathologist?
So a speech pathologist can be helpful when you're interested in getting more intensive or more individualized care. Maybe the speech toolkit is really helpful, and that's great. Maybe it's like, well, this is helpful, but I would like more on how do I tailor it to like talking class, or how do I tailor it to the specific environment or activity. So a speech language pathologist can help you with that. The other thing I wanted to bring up is that an SLP can help you adapt to changing needs. So as we go through the progression of FA, sometimes we need different things, or what was working at one point is not really enough later on. So an SLP can help you work through those situations. You get one-on-one attention. An SLP can also help with the listener strategies. So it can put the workload on somebody else, right? So it can help your family members, caregivers, teachers, with strategies to help be a better listener for a person with dysarthria. Something else is what we call AAC, and AAC stands for Alternative and Augmentative Communication. So AAC can look very different. It can be simple strategies like writing something down in addition to speaking it to make sure your message is clear. It can look like, setting a topic of conversation to make sure the listener has a context of what you're talking about. And that can help make your message be more understandable. It can look like more high-tech things, like maybe using an iPad or a specific device to either supplement or replace your voice, with the intention that it's all about helping you communicate the most effectively that you can. So a speech pathologist can be very helpful in personalizing that and figuring out what the right strategy is for you. And the last thing I'll point out is that if you do have swallowing concerns, that is a good thing to talk with a speech pathologist about. So anything like choking, coughing on food or drink, usually dysphagia, the swallowing concerns, and dysarthria go hand in hand. So whenever there are those concerns, speech pathologists can do extra testing and treatment focused on dysphagia.
Well, great. Well, now that we kind of covered that, I wanted to ask, so if someone in the audience really resonated with this, or maybe they get to a point where they're considering this, where would they get started at finding a speech and language pathologist to work with?
So probably the first thing is to talk to your neurologist or primary care provider. They might have a short list of people they commonly recommend. Often that's going to be an outpatient referral. So outpatient means you go to a hospital setting or a healthcare clinic for these services. Another option might be a university clinic. So like where I work, the Indiana University Department of Speech and Hearing, that we have a clinic with full speech pathologists, and we have students who are in our program learning to be speech pathologists. And so the clinical faculty works with the students and our patients to kind of help the student learn about how to treat disorders. And a lot of times people can get into the university clinics faster and a little easier than they might be able to get into a healthcare setting. Teletherapy might be a really good option. These are usually governed by the state. So it's like, if I live in Indiana, I have to go to a speech pathologist within Indiana, but they can use Zoom or another platform like that to do therapy just wherever you are. And another fourth option that I realized I didn't put it in here, there can be home health care. So you can get a person to come to your house in person if you work through an agency like that. A tip is to ask speech pathologists if they're familiar with the FA or if they have treated SCA, so spinocerebellar ataxia, or similar conditions like multiple sclerosis or Parkinson's, if they haven't treated FA before. They should know about FA. It's in all of our textbooks, all of our training. Another tip is to be clear about why you are seeking therapy and what you want to achieve. So even though you are asking them for help, you should be kind of the driving factor. What you want should be what you get.
Well, excellent. I know that you mentioned a little bit about the FA clinical management guidelines. So I wonder if you had anything else to expand on that, or?
Sure, these guidelines, so again, they're on the FARA website. So for Dysarthria, things like behavioral therapy, which means going and talking and working on things like breath support and voice and articulation and being clear, those are highly recommended for people with the FA. So there's not a lot of evidence about AAC, but that is something we're kind of working to get more evidence about in FA. We don't currently have evidence for like a drug specifically to treat Dysarthria in particular. So what that means is sometimes in other disorders, things like Botox might be very helpful. And that is a drug or a pharmaceutical intervention meant to treat dysarthria in particular. And we don't have that currently for dysarthria and FA.
Thank you so much. And I know that there are some other clinical guidelines as well, but I was wondering if first you'd be willing to expand, how do you think it's most effective for patients to utilize this resource? Because it's a little different than the other ones that we've discussed.
So that's a great question. So this can be really helpful to take to your speech pathologist and say, here, if you don't know about FA or if you're not very familiar with it, there is research evidence out there that experts have put together, because it's probably not practical to expect every speech pathologist to be an expert in FA, but they do have good resources on the FARA website in these clinical management guidelines to help that SLP be a little more of an expert.
Great, thank you so much. And that's a great segue into kind of the next question that I had for you, which is, is there any research or other things that are happening in this space that you think the community should be aware of?
Yeah, so Dr. Adam Vogel in Australia put together this Melbourne Ataxia speech treatment. So I think this is an ongoing study, ongoing research on biofeedback, getting some visual biofeedback to help patients kind of monitor their speech in real time and get information that a cerebellum should provide you, but it doesn't because of FA. So how loud are you being? How much breath support do you need? How long are pauses? So that can be a treatment program that a speech pathologist can follow. I'm working with Dr. Vogel and Jen and Dr. Lynch and some of the other wonderful people here at FARA to try to understand speech in children and adolescents with FA better. So right now, a lot of what we know is based on adults who have FA, but as we know, the most common age of diagnosis is between 7 and 15. So you would think symptoms might be a lot different in adults versus children. So we're using some data from the TRACK FA studies to characterize the speech skills of children and teens. This is ongoing, but we wanted to let you know it's coming. And the last thing I wanted to bring up is self-disclosure. So self-disclosure is something that there is research on in the speech pathology field, in stuttering especially. And self-disclosure means setting the stage for a communication partner, maybe a new person. Like, hey, I have FA, I have dysarthria. It's going to take me a little more time to communicate, and acknowledging that you are aware of it, making the other person aware of your needs makes everybody feel more comfortable. So it not only helps with the anxiety, but then, helps you feel okay with slowing down, getting that good breath support, getting the good voice under control. And Brigid, I think, has a story about how self-disclosure is really helpful.
When we were talking about this topic and Caroline brought this up, it resonated because I've seen this in action in congressional meetings where people either go in and they don't say anything, and then they're very conscious of what they're saying in the meeting, and they may stop, or they might say, it's okay, I don't want to, I'll just go to the next person. They kind of give up. Or someone goes into a meeting and they upfront say, I have FA, it's going to take me a little longer to tell you my story. And what I see is the staffer starts to sit up and pay attention to the person a little bit closer than they were before. They may stop taking notes and now they make eye contact with that person. It's a really effective way to level the meeting so that everybody is on the same page, that we're going to be able to talk a little bit differently right now.
Great. Well, thank you both for that. Want to be cognizant of time so that people can ask questions, but we wanted to summarize a little bit of what we've talked about today. So first and foremost, we want to reiterate that almost everyone experiences nervousness when speaking in public or in new situations. I think most of us have physiological responses being up here today with the lights in your face and all these people out there. We also want to acknowledge that speech is integral for advocating for your needs in self-advocacy, like we discussed, and the needs of the community, whether it's in congressional meetings or through other mechanisms. Like Brigid just mentioned, self-disclosure sets expectations, which lowers your stress and helps others to support you. And finally, we just wanted to provide a couple little tips. Let's practice what you would like to say. It's okay to take your time. It's okay to pause. It's okay to catch your breath or reset your thoughts or ask for a minute or take a glass of water, because what's most important is that, you're sharing your needs, you're telling your story, and you're making those connections. With that being said, we want to open the floor up to Q&A. We have a decent amount of time, so we're happy to answer any questions, and if not, we're also happy to stick around. We'll be around.
First of all, Dr. Spencer, I guess Kyle Waterman's probably not going to be very happy with you right now, because your Hoosiers beat his beat his team. I'm curious to know a little bit of your backstory and your personal story and how you came to be interested in speech and got into your field.
That's a great question. So I have FA. When I got into speech pathology before I was diagnosed. So through undergrad, I found the field, and I really still like it because it's kind of a mix of language, reading, science, healthcare research, kind of a mix of a lot of things. And the possibilities of being a speech pathologist are really endless. And then after I got diagnosed, so I was actually in the middle of my graduate program, and looking around for clinical jobs. I ended up finding a job in research, and I did that for a couple years, and then decided I wanted to go on and be able to do my own research. And I like the ability to really make an impact on people, patients, but also students. And I really like the research and the teaching component. So I'm researching speech in FA, doing that speech in kids and adolescents. And then I'm also doing a little work on residual speech sound disorders. So kids who have trouble saying the R sound, who don't have FA. So trying to understand why they don't say that, and can we detect it earlier?
Great. Anyone else? It's like I want to give one more opportunity.
Well, while we're waiting, in case anyone's thinking of a question, I will just highlight when Caroline was talking about telehealth, that was definitely something that, I thought, oh, here's a great opportunity to share with everyone and where you can get involved in advocacy, because a lot of the telehealth coverage came during COVID. And there's a lot of discussion on the Hill about how much they should continue to cover telehealth or whether you should be required to go back to a doctor's office. And so rare diseases in general do much better if we have telehealth because there are few specialists that understand our condition. And so it saves the patient from traveling across the country, but it also allows a specialist to call in to your care team and meet with your care team in your state to talk about what your needs are and help develop a plan. So as legislators are starting to have that conversation and propose different bills, this is where your impact would mean so much, because you can share how telehealth has either helped you or has opened opportunities like speech and language pathology that you might not have been able to have in your home area. And by sharing that, you may impact what they actually pass in the future. So stay tuned, read our newsletter, so you know how to get involved in that area.
Yeah, great. Thank you for bringing that up, because that's very actionable and very timely, considering a lot of the public health emergency provisions and things that were extended for a period of time after COVID are beginning to expire. So thank you for that.
When the pilot study toolkit was launched and then the final toolkit was launched, what sort of response or feedback did you get from the community, maybe to push people or give people an incentive to try the toolkit and maybe test it out?
Thanks, Mary. So what Mary's speaking about is when we first created the toolkit, we asked our ambassadors if they could help us refine it. And some of the ambassadors had signed up for an Every Life Foundation program called Rare Across America. And this is when legislators go home to their home district. You can meet with them at home rather than in DC. So we asked the ambassador team, is anybody doing Rare Across America? And we had about 7 people that were doing it. And we said, we want you to pilot our toolkit. We're going to send it to you before it's public. We want you to use it however you'd like. Spend as much time as you think you'd like to enjoy it. Then do your meetings, and then come back to us and give us feedback. Was it helpful? Did it give you some information? Did you try some of the strategies? Were your meetings better? Because that was ultimately the goal of the toolkit, was to make everybody feel more comfortable and confident in sharing their stories. And so we were very fortunate that we've got wonderful responses. We got a few suggestions on things that we could add, and we are in the process of putting some additional things into the toolkit because of it. And then we officially launched the toolkit for our Hill Day, which we do with NAFT, and we shared it obviously with both communities and have gotten some feedback from the other community as well, that people really enjoyed having that as a resource. But I even have had people talk to me about, outside of the Ataxia community, how some of the exercises might benefit their community that have speech challenges. And that was the ultimate goal down the road, was that hopefully people, anybody who has a speech challenge, could take some of the exercises that are in there and try them to make themselves more comfortable and confident as a speaker. Thanks, Mary.
So I had a question, actually. For Hill meetings, as I know you guys know, they often only have I don't know, maybe 10 or 15 minutes, and we want to be respectful of their time, but how do we strike that balance of being respectful but also making sure that everyone in the group, who maybe people who have slower speech, feel like they're able to share their story? Especially Florida is often a large group, so I struggle with that.
Thanks, Chandra. So the meetings vary in size, right? So if you're from a state that has a few advocates, then you have an opportunity to really delve into your stories more than if you're at Florida or New York or California or Pennsylvania. We had very big groups participating this year on Hill Day, and you want to give everybody a chance to share their story. So there's two things you can do. One is you have Senate meetings and you have House meetings. And usually in a Senate meeting, you have everybody from the state. Those are going to be larger groups. So maybe in those meetings, you maybe think of the one point you want to make, that you're going to introduce yourself, say where you live, and maybe make the one point that you want to say. But in your House meeting where there's going to be less people, because now it's your district, or you might just have the larger, like Florida, California, we would break you guys up into teams for the House meetings. You have a little bit more time to share your story. That said, these are just introductions to these offices. So when you're done with your meeting, don't feel like you can't talk to the staffer that you just met with. Follow up with an email to all of the staffers afterwards to thank them for their time, but then you can actually expand on your story and share a little bit more detail that you might not have gotten to during the meetings.
No, I was just going to say, yeah, I would concur. And I would also say, we also just give asks as kind of guidelines, right? They're not prescriptive for meetings. You don't have to cover every single bullet point. And so if a really good conversation gets going on one particular ask, follow up on the other asks with them, like Brigid mentioned. The relationship doesn't end there. But also just don't feel like you necessarily have to cut a really good conversation short to squeeze in every little bit of information that's on, the Hill Day platform. It's okay to let it be a little organic and follow up and continue to discuss these things over time as they continue to evolve. Well, I think that we've run out of time, but thank you all for your really wonderful questions. And if you do have additional questions, please come find any of us. We'll be here for the rest of the day.